Welcome to the training for healthcare professionals. Let's begin with the module on providing hair care to patients. Let's take a look at the key learning objectives. After completing this module, you will be able to know the importance of patient hygiene, provide for patients' personal hygiene needs, take care of patients' hair. General quality and growth of hair is an indicator of the patient's health. Factors that affect hair are hormonal changes, emotional and physical stress, aging, infection, certain illnesses, treatments. Lack of nutrients and poor hygiene can cause severe changes in hair color and condition. Assessment of the patient's hair includes the following: observing hair and scalp for dandruff, checking for loss of hair, also known as alopecia, oiliness and texture of hair, observing if there are any scalp infections, lesions, inflammations, or presence of parasites such as lice. Here's the checklist of items required for a patient's hair care. 1. Lukewarm water. 2. Buckets and mug. 3. Towels. 4. Shampoo. 5. Oil. 6. Comb or a brush. 7. Shaving foam or cream. 8. A razor. 9. A rubber sheet. 10. A curtain to protect the patient's privacy. Regular brushing and combing helps keep the hair free of tangles and distributes oil evenly along hair shafts. Braiding long hair also helps avoid tangles. To brush hair. 1. Part the hair into 2 sections. 2. For longer hair, divide the sections into smaller sections as it is easier to brush. 3. Take a wide-mouthed comb or a brush and start combing from scalp towards hair ends. 4. Apply a little oil if needed. 5. Braid or gently tie long hair into a comfortable style. Excessive sweating, staying in bed long hours, or treatments that leave blood or medication in hair may require frequent shampooing. If the patient can be moved to a stretcher, take him or her to a wash basin for a hair wash. For shampooing the hair of bed-bound patients,
drag the seek bar to know more.
First, wash hands and wear gloves. Place a rubber sheet to protect the bed. Place a tub under the patient's head and wet his or her hair. Apply shampoo and rub well to clean hair. Pour water to rinse off the shampoo. Reapply shampoo if needed. Dry the hair by gently rubbing it with a clean towel. Patients with a mustache and beard require daily grooming. Mucus or food particles may get stuck in these areas and can cause infections. You should wash these areas with soap and water when giving a bed bath, and trim regularly with patient's consent. You should shave a bed-bound patient's facial hair during a bath. Take care to avoid cutting the patient's skin with razor blades while shaving. Use separate and new shaving items for each patient. For shaving facial hair, place a warm, wet washcloth over the patient's face to soothe his skin. Then place a bib under the chin. Apply shaving cream or foam. Pull the skin taut and shave, using firm razor strokes in the direction of hair growth. Wipe clean with wet washcloth till all the lather is washed. Always remember the following points.
Click each image to know more.
Never cut a patient's hair without the consent of the patient or his or her relatives. Encourage patient independence wherever possible and regularly instruct patients about hair care and hygiene. Check regularly for and remove parasites. Use medicated oils, shampoos only on doctor's advice and prescription. Use only the patient's personal comb and brush. Clean the comb and brush regularly. Now let us see a demonstration to provide hair care to a patient.
Having clean, combed hair is an important part of feeling comfortable and can help the person feel more like themselves. Helping the person wash or style their hair, or helping a man shave, can aid in preserving the person's sense of identity and dignity.
I'm here to wash your hair. Oh, exciting day.
Washing a person's hair when they're no longer able to be out of bed requires a fair amount of preparation, but will be very refreshing. For people with reduced energy or capacity, there are also special aids available, such as inflatable shampoo basins and waterless shampoo caps that can make washing hair in bed easier. These are available in healthcare supply stores. To wash a patient's hair in bed, begin by covering the bed with garbage bags or moisture-proof pads to keep it from getting wet, and place a pail on the floor below to catch the dirty water. Gently position the person so their head is slightly over the edge of the bed,
Bend your knees.
being sure to explain and reassure the person about what you're doing.
How's that?
Okay.
Okay, now I'm just going to put another towel, so if you can just lift up here. Yeah, there you go.
Okay.
Okay, and I'll put our...
Wet the hair with clean, warm water
Not as easy.
You got to get the crown.
and gently shampoo and massage the person's head. When shampooing and rinsing hair, watch for open sores, dry areas, or pressure areas, particularly on the back of the head and around the ears.
Yeah, a little bit.
Rinse well using warm water, collecting the water in the pail on the floor.
You've got nice curly hair.
Towel off the hair and comb and style as usual.
See, oh, just lift up a bit. See, how are we here?
When helping a male patient shave, use an electric razor to reduce the risk of accidentally cutting the skin.